Well, there is no easy answer, no one-size-fits-all approach, and health experts say that sometimes a runny nose is just that, a runny nose, but it's when those symptoms stack up that is cause for concern. It's a place for kids to play, but it's also a place where kids can spread germs. Inside the classrooms of St. Miriam Preschool in Flowertown, it is constant cleaning and also constant calls for the school nurse.
And it is ever changing. It is. All of the teachers have my cell phone number. All of the administration has my cell phone number. I get calls all hours.
Caitlin St. George says she started off the year trying to create a total plan or policy, but it was nearly impossible. After all, kids get colds, and she says each cough and sneeze has to be examined before the kids are allowed with the rest of the children.
Am I sending my kid to school every day with a kid who could have a sneeze and it could be COVID? Maybe. But could it also just be an allergy? Maybe it's that too. And that's what's we're facing with a lot of parents, and we here take it case by case.
Children, when they cough, they don't emit as many respiratory droplets. Their cough is not as forceful as adults.
There is some good news for kids in COVID, according to Dr. Mesa Abali of Einstein Medical Center. She says kids are no longer thought of as silent spreaders, and the majority don't have as severe symptoms as adults. That said, she recommends any child who has had contact with a COVID case get tested.
We need to be able to isolate children that are COVID positive to avoid spreading it.
And while both women say a runny nose isn't reason to panic, other symptoms like difficulty breathing, a loss of taste and smell, and constant coughs are signs to get tested. And they also recommend you taking all precautions you can.
Wearing a mask and washing our hands and keeping distance are all things that are very basic things.
Now, it's also recommended that if your child is sick, showing any of those symptoms, that it's best just to err on the side of caution and not send them to school or daycare. Also, doctors say that while we are not predominantly testing children for COVID, there are many other tests that are widely available that are rapid tests that can rule in or out certain illnesses like the flu and RSV. Always why it's best to consult with your doctor, especially during this pandemic. In Springfield Township, Montgomery County, Deanna Durante, NBC10 News.